How you doing? I'm Dr. Braxton and I am the chiropractor at WJ Med Spa. Sciatica is an irritation to the sciatic nerve, which is the largest nerve in the body. It starts in the last 4 vertebrae of your lower back and comes out of the spine, splits and goes to both legs down to the feet. Most of the time, the irritation comes from a herniated disc. It comes from a strained muscle or the piriformis muscle that's in a very small muscle in the butt that gets inflamed and squeezes on the sciatic nerve, which is the largest nerve that causes the irritation. If left untreated, the long-term effects will be neuropathy to the feet and a constant pain down the leg, deinnervation to the lower leg muscles, which can cause atrophy to those muscles and loss of use. I provide treatment options of adjustments, deep tissue massage, stretching, and reinnervation to the nerve to kind of excite it again to help reinnervate those nerves, the muscles that have been deactivated from the continual compression to it. If you're a bus driver or a truck driver, most of the time it's because you're doing this constantly in the seat and you're aggravating the piriformis and the gluteal muscles that constrict onto the sciatic nerve. So a lot of that would come for truck drivers and bus drivers that I treat. They would be stretching and stripping out the muscles from the gluteal down to the hamstrings. Other instances are just the rotation of the spine, which is you would need adjustments. And if it's a herniated disc, we do distraction to help pull apart the vertebra and open up the disc area so the nerve can exit the spine and have more room from a herniated disc, which is kind of pressing on it. And kind of think of a jelly donut that when you squeeze it, some of the jelly comes out the side. That's what the herniation is. And so when we do decompression and distraction, we're pulling apart the spine a little bit at a time to help suck a little bit of that jelly back in to take that bulge off of the disc. Just have you lie back. And I would tell you, either if you want to try and do it without a towel or with a towel. So you can get a bigger stretch with a towel because you're able to pull your leg a little bit more. One of the important things is as you do this, just totally relax your leg as you let it come up. And then you'll find where it starts to pull and where it starts to restrict. And when as soon as it gets tight, that's where you know your start of your stretch is. So to help release the hamstring muscle, I would tell you to contract your quad muscle. So when you contract this muscle, your focus is now off of this muscle and the leg is able to continue up to help stretch this muscle out. Okay? So that's going to help stretch part of the hamstring. You also have to think about the calf muscle. So all you want to do is flex your toe to you. You're going to feel that pull, you're going to feel that burn. You want to hold 7 to 10 seconds and then just release. Come off just a little bit out of the stretch, not all the way, but just to where you feel it release a bit. Stay out for a few seconds and then slowly go back to where you felt it start to burn and then give it one more little push and hold there for another 7 to 10 seconds. Then I would just flex the toe down and we get that one. And as you can see, you get a different feeling on each of them, correct? That's right. So that's one for the hamstrings. Now, if you're having a hard time doing it, I would tell you to put a towel around here. You can grab the towel and give the pull yourself. Biggest mistake most people make, they allow the knee to bend. Once you allow the knee to bend, you now have released the hamstring and it's no longer stretching. So your big thing is lock the knee out, take it to the burn point. Know that you're going to feel a burn because that's what a stretch is about. Quad muscle tight, and then you can go a little bit further.
And I guess that's why contracting the muscle is so important.
Exactly. The other one you want to do after you do that, you relax it for a second. I want to take this toe and I want to go over that shoulder. And what you're going to feel is you're going to feel this through the piriformis muscle in your butt and down the side of your leg where it gets the IT band to start to go. And that's a real true burn. Most people don't like this one at all. And once you feel that burn, you're like, okay, 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 okay. You do the same thing. You just hold it for 7 to 10, bring it off for a little bit. My next one is I go right to that point of where I was feeling the burn, give it just a slight more push into it, hold it for 7 to 10 seconds, breathe through, and relax it out. Your eyeballs rolling in the back of your head. I don't know if that's a good thing or bad thing, but right now we're going to go that it's good. The other one I would have you do is I'd have you bend your knee and just grab your knee and pull it to your chest. There you go. Just give a nice pull. And as you hold it there, now I want you to try to push your knee out while you hold it down. There you go. And relax and pull it to you. It should go a little bit further. Push it out, hold and push, and relax and pull. And each time it should go a little bit further because you're causing the antagonist and the tagonist muscles to fight and go against each other. So each time you can get a little bit bigger. All right. Then you're going to relax. You're going to put your foot into the number 4 position and just kind of let your leg hang there. You want to stretch these inner muscles in the inner quad area because they're also going to restrict and hold you. And then you just slightly get a little push down and let that one just kind of just slowly stretch itself. And bring it up. Let it sit evenly. Always do both sides. Even if your pain is on one side, you always want to do the other side. So we would have repeated the exact same position on the other side, but then we're going to put your foot into the butterfly and just relax it and just let them stretch themselves down. All right. So we started off single leg doing hamstring, then we did calf by pulling the toe towards you. Then we did your piriformis and a little bit of your IT. Then we did your inner quads, right? Now we bring them back up. We'll do them both together. So I take them up. Hold. I would be always place a little pressure so I keep the knees locked. Have you take a nice deep breath, blow all the way out, and let your legs come on up so you can feel that go. Very nice. Slight rotation and roll in it just to kind of release the lower sacrum area. And go back the other direction. And as I have your feet up in this position from my presence, I can see from right here that your left leg is shorter than your right leg. If you can see right there, you can see this different spacing just from that. That means your pelvis is slightly twisted and tilted off to one side. It's either the way you sit a lot or the way you walk.
I favor this side a lot because I had knee surgery.
And that can definitely cause you, because you have a different gait to it because of the pain. So that's a lot of the lumbar spine stuff there.
That's a workout within itself.
And you didn't even have to move, huh? You can do the same thing by when you sit up, just stretch straight down to your toes.
Like this.
Yep. And just take a nice deep breath in and blow it all the way out. Very nice. And again, you can see that this foot is out in front of that foot, just by the way you have held your lower. All right. So those are some of the stretches I'd go through in that position with you. Then I'd bring you on up. I have you stand up right here. And what I do is called the sumo penguin stretch. So you're going to turn your feet out. And you're just going to allow yourself to go all the way down as far as you can go. And just kind of totally squat down as far as you can go. And let that relax all the way in there. Okay. People with knee pain might have a little problem. They might want to have something close to them so they can support themselves as they come up. And then you also don't want to just try to bounce up. You just kind of want to bring yourself up nice and easy. Again, use your legs to bring yourself up. Kind of like that, yep. Try to bring your back up and sit your butt down into it. There you go. Hold it for a few seconds and then just walk yourself on back up. Remember, try to help and support yourself so you don't have to use muscles that are not ready to be worked. And then bring yourself and straighten all the way up. There you go. So if you're having any problems with sciatica, low back pain, or any symptom that you're unsure what the problem may be, you can reach me here at West J Medical at 5185 Overland in Culver City, California.